Well, let's look at a drug they use for heart disease and strokes. Alteplase, otherwise known as Activase or cath flow activase. This is just one drug they use, and you'll see what it's used for. Highlighted sentence at the bottom. Alteplase is a thrombolytic drug, sometimes called a clot-busting drug. Let's look at its side effects. N-acetylcysteine doesn't do this, but it breaks down blood clots. It's amazing. You're going to see a study here in a minute. It's going to blow your mind. Serious side effects of alteplase. These are the more common side effects. Bleeding gums. Oh, that sounds awesome. Coughing up blood. Who wants to cough up blood? That sounds horrible. These are the more common side effects. Nosebleeds. Paralysis. Could you imagine being paralyzed by a medicine they're trying to give you to break down a blood clot? Oh my God, that's awful. The threat of stroke is that you're going to lose the ability to control parts of your body, being paralyzed. The drug has this as a more common side effect, people. Increased menstrual flow or vaginal bleeding. Sounds amazing. Rare side effects include unexplained shortness of breath, sudden severe weakness or numbness in the arms or legs. That doesn't sound good. Sudden loss of coordination. Slurred speech, like a stroke. Rapid shallow breathing. Fast heartbeat. Fainting. Confusion. Vision changes. You either can see or you can't see. So your vision must be getting worse. All right, so that's that drug. N-acetylcysteine doesn't do any of that, but it does help prevent blood clots, even as powerful as most blood clotting drugs. 9, benefit of N-acetylcysteine per Healthline magazine. It has the ability to boost glutathione levels and improve immune function. Research on certain diseases associated with N-acetylcysteine and glutathione deficiency suggests that supplementing with NAC might improve and potentially restore immune system function. Whew, well, you're hearing about Make America Healthy again. N-acetylcysteine can make your immune system healthy again. All right, this is some research articles that are now we're going to highlight the science, the cool things they found in scientific studies when they looked at N-acetylcysteine with other drugs or placebos in different conditions in human beings. N-acetylcysteine for the treatment of psychiatric disorders, schizophrenia. N-acetylcysteine acts at multi-points within the brain to potentiate activities that are beneficial to schizophrenia. Patients treated with N-acetylcysteine showed increased multivariate phase synchronization brain function that altered the neuron connectivity of the brain, measured using electroencephalogram, a device in medicine. N-acetylcysteine may be efficacious in reducing both negative and general symptoms of schizophrenia. How many of you have been told that? Has your neurologist told your loved one about N-acetylcysteine in these studies on schizophrenia? A meta-analysis looking at multiple studies included 3 randomized control trials with 307 participants showed that N-acetylcysteine significantly, not a little bit, significantly improved total symptom score in schizophrenic patients. 307 people with schizophrenia. They further went on and reviewed an antioxidant treatment for schizophrenia, have also found that N-acetylcysteine to be a promising add-on treatment for schizophrenia, and the 3 or 4 studies referenced there. Then there was a large, several clinical trial found that taking 1,000 milligrams a day of N-acetylcysteine twice a day, 1,000 milligrams twice a day, to be more effective than taking a similar dose schedule of placebo in improving the total negative and general symptom scales of 140 chronically diagnosed schizophrenic patients over a 24-week period. Ask your doctor if N-acetylcysteine is right for you. And just so y'all know, if you think this is just for schizophrenia, schizophrenia is labeled as the worst of all mental health diseases on a scale. Everything below schizophrenia is bipolarism, OCD, manic depression, general affective depression disorder. All of those are less severe than schizophrenia. If N-acetylcysteine helps with schizophrenia, any of the other ones I just mentioned, for sure NAC will benefit. Those treated with N-acetylcysteine, 1,000 milligrams a day in the first week, they then increased it to 2,000 milligrams a day for 7 weeks, achieved, listen to this, statistically significant improvements in the total and negative symptoms of schizophrenia. compared to those on placebo over the 8-week period. A very large clinical trial is currently being conducted across 4 Australian sites to investigate the efficacy of N-acetylcysteine as an adjunctive medication and added medication to clozapine in the treatment of schizophrenia. Did y'all know that? That's what these researchers have discovered. No American clinic's doing that. 168 clozapine-resistant schizophrenias. This means 168 people with schizophrenia were given this drug, clozapine, and it didn't do anything for them. It failed them. They took 2,000 milligrams a day of either N-acetylcysteine or a placebo for 52 weeks, a whole year. Positive results from the trial will certainly confirm that N-acetylcysteine is an effective add-on treatment for schizophrenia. Now let's look at OCD. I have some very close friends who are OCD. I don't have any family members I know that are OCD, but I have a lot of people I know that are OCD. Did you know that N-acetylcysteine has been proposed as a novel treatment? Other related disorders such as trichotillomania, hair pulling disorder, eyebrows, eyelashes, skull, beards, mustaches, onychophagia, nail biting, Tourette syndrome, and excoriation, skin picking, also share some common neurobiology that can be potentially treated with N-acetylcysteine. Amazing. A thorough review of the literature on medical studies on N-acetylcysteine found that a review of N-acetylcysteine for the treatment of obsessive compulsive disorder and related disorders by a researcher named Oliver. And they show the reference. Treatment with 2,400 milligrams to 3,000 milligrams a day of N-acetylcysteine in the included trials was found to reduce the severity of symptoms and demonstrates good tolerability and minimal adverse effects. Isn't that awesome? N-acetylcysteine to be an effective add-on citalopram in improving resistance control to compulsions in children with OCD, obsessive compulsive disorder. N-acetylcysteine was found to be an effective add-on to citalopram in improving compulsions in children with obsessive compulsive disorder. Significant reduction in the score of resistance to obsessions was detected in the intervention group after supplementing with N-acetylcysteine 2,400 milligrams a day for just 10 weeks. There was no significant changes seen in the placebo group, only in the N-acetylcysteine group. Anybody out there who knows obsessive compulsive children who have outbursts, N-acetylcysteine 2,400 milligrams, you can get it at the Dr. Ardis show or anywhere else on earth if you want to. Now for mood disorders and bipolar and depression. They have found research now linking low mood to being increased oxidative stress on the human body and dysfunction of the glutamatergic systems, with N-acetylcysteine being explored as an adjunctive therapy alongside primary antidepressant treatment. Trials using N-acetylcysteine for depression symptoms, regardless of the main psychiatric condition, they found a total of 574 participants. 291 N-acetylcysteine, 283 were given a placebo. N-acetylcysteine was shown to significantly dissolve and destroy depression symptoms and improved overall human functionality. Incredible. How many of you know people on Prozac, Zoloft, and other antidepressants? Did you know that N-acetylcysteine is cheap and doesn't require a prescription of any kind? And has already been proven to ameliorate. That means to get rid of all symptoms of depression. Isn't that amazing? A new trial explores the effects of adding N-acetylcysteine treatment with inflammatory and neurogenesis markers in the single polar depression people. So you have bipolar, means there's two forms of mental function. You're either high functioning for a while, then you go depression. That's bipolar. In this case, these are just people that are just overall depressed all the time. They're not seeing upswings and downswings. They're just always down. So in unipolar, that means one. We've only seen one in one type of depression. You're just depressed. N-acetylcysteine treatment of 2,000 milligrams a day significantly improved depression symptoms over the 16 weeks trial. I'm sure you guys were not aware. I'm very, very thrilled to know that N-acetylcysteine, a very common supplement, cheap to provide to people around the world, found in foods, vegetables, fruits, and nuts, can be compiled at milligram doses in convenient capsules to help improve your mental state. Studies support the continuing research effort in the study of N-acetylcysteine for the treatment of psychiatric disorders. The available evidence certainly supports N-acetylcysteine to be a viable added treatment option in clinical settings. And this is the dose range, everybody listening. If you have a loved one who has depression symptoms of any kind, a dose range between 2,000 and 2,400 milligrams a day was suggested to be effective and well tolerated from these research studies. This is N-acetylcysteine, one of those studies, N-acetylcysteine in depression symptoms and functionality. Treatment with N-acetylcysteine improved depression symptoms as assessed by this scale they use, Montgomery-Åsberg Depression Rating Scale, and the Hamilton Depression Rating Scale when compared to placebo. Subjects receiving N-acetylcysteine had better depression symptom scores on the Clinical Global Impressions Severity of Illness Scale at follow-up than subjects who did not get N-acetylcysteine. Global functionality, how the whole person behaved and functioned, was better in the N-acetylcysteine groups than in the placebo groups. Conclusions. Administration of N-acetylcysteine ameliorates, dissolves depression symptoms, and improves functionality and shows good tolerability, meaning no side effects. The effects of N-acetylcysteine supplementation on sperm quality, chromatin integrity, and level of oxidative stress in infertile men. This is where I told you early on in this broadcast, I'm going to show you studies that will blow your mind. If you are struggling to conceive, if you are thinking about infertility clinics as a couple or a person, you've got to consider N-acetylcysteine, and I'm going to show you why. N-acetylcysteine supplementation significantly improved sperm total swimming, called motility, progressive motility, its ability to go farther, and sperm concentration, how many sperm the man made. The average percentage of non-progressive swimming of the sperm and immotile sperm, those not swimming at all, and abnormal morphology showed a significant improvement after treatment. So they saw all of those things reduce. The sperm that couldn't swim, the sperm that couldn't swim very far, and DNA damaged sperm. They saw that all reduce in the N-acetylcysteine supplemented group.